Okay, good day, everyone. I'm Bruria. I'm the head of the Emergency and Disaster Management Department in the Tel Aviv University, and I'm happy and honored to open this webinar, which will focus on learning from the present COVID-19 crisis while looking at the future of disaster management. The current coronavirus crisis presents a global challenge, of which the international community has not had to deal with in the past years. Nonetheless, history has taught us that this is not the first time that the world has needed to cope with such a wide-scope pandemic. Even before mankind had the ability to travel so easily from country to country, the viruses managed to do so, and the spread of varied diseases proved to be lethal to millions of people throughout the world. The present crisis in many ways requires us all to segregate, to be isolated, home quarantine. And some people wonder whether the world after the coronavirus will revert back to each country concentrated solely on its own population. I believe that the opposite is the case. We're all familiar with Francis Bacon's revelation that knowledge is power, information is power. Benjamin Franklin even went further, stating that an investment in knowledge pays the best interest. This is where we're all standing today, sharing information, viewing the past while looking at the future, studying the data that we can all collectively gather in order to plan together how to overcome challenges, analyze different consequences such as the medical, the social, economic, ethical, and more, and collaborate even more closely than before, so as to enable us all to combat the current hazard, the coronavirus. Disaster management is a profession, and all of us here are part of the faculty in the Emergency and Disaster Management Department, and we would like to share knowledge, insights, discuss different aspects with all of us today that have gathered here as now. On behalf of all of us in the Emergency and Disaster Management Program in the Tel Aviv University, I would like to thank you all for joining us today and for the joint opportunity to work together to combat the COVID-19. Our mutual support and solidarity makes us all stronger and more resilient. In the effort of discussing together questions that concern all of us and what we need to do and can do in order to bounce forward, we have with us today the following panelists. All of them faculty in the master's program of the Emergency and Disaster Management to provide a multidisciplinary perspective. I would like to welcome Professor Alkan. Mick will address medical and ethical aspects. Professor Nava Haruvi, she will address the economic implications. Mr. Gili Shenhar will relate to risk communication, varied channels of communication. We have Dr. Zohar Rubinshtein that will address resilience and mental health, and Dr. Moran Bodas, also part of the faculty, into very much studying non-conventional scenarios as well as disaster psychology. I would also like to introduce you, even though we don't see her, Ms. Orit Cody from our international program, international school. Before we start, I would like to ask all of you to very quickly update us through the icon that you will be able to press now to update us as to where you are based in the world. Orit, can you put the poll? Thank you. Okay, I hope everyone had a chance to submit the response. Orit, can you share with us where we have participants from?
We have 64% who voted, and the most, so there's still a few more voters, but so far we have the most people from Europe attending our webinar currently at almost 50%. 7% here, let me just share the results with you. 8% from North America, Israel 21%, and a bit from Asia, India, and Africa. I wonder who's coming from other, but we'll have to keep guessing.
Thank you very much. So now that we know where you're coming from, I would like to just give you one more logistic information. Since we have an hour at our disposal, you have the opportunity to ask elements that are important to you through the Q&A. You can see the icon Q&A, and we will be able to raise the different questions that interest all of the attendees as much as the time will allow us. So I would like to refer the first questions to Professor Alkan. Mick, can you, we've seen in the world now different models of managing COVID-19. Some focus on mass testing, others on lockdown and so on. All are targeted to achieve the same goal of containing the coronavirus. Which model is actually proving to be more effective and why? But please unmute yourself. Thank you.
This is a complex question. The issue with the data that we see is really erratic because what we really miss is the denominator. And in order to see how frequent the infection is and how serious it is and how many people have died or will die of it, we need a denominator which we don't have. Now, even with widespread testing, it all depends on who you test. Do you test anybody with fever? Do you test anybody who has come in contact with a patient? These are very serious issues. On the other hand, the solid data is the absolute numbers, not relative to population, not relative to anything, of seriously ill patients or fatalities. And in this sense, we can grade countries to the severity of the epidemic. However, there's a big issue there because all we can say is what is true today. We don't know about tomorrow. And this, I think, should be the mantra for our discussion because we really cannot tell what the future has in the corona epidemic still waiting for us.
Thank you, Mick. And Mick spoke about the uncertainty. And Nava, I would like to ask you about another issue of uncertainty. And that is, what is the certainty or uncertainty concerning the economic consequences of the COVID-19? Are we actually heading to the worst recession that we have known in the past decades?
I'm afraid that it's the only certain thing in this situation, that it won't be a recession. It will be a very big depression. It can't be otherwise, because there will be a real scarcity of products. It's not anymore an economic bubble like it was in 2008. It's a real depression, a real scarcity of products. Country can't produce products, and people can't or even are not allowed to consume products, not to say that they are not allowed to consume services. So the only thing that the government can do is print money, but money without products has no value. Money will lose its value. The obvious forecast is obvious, is massive unemployment and inflation that usually don't go together in historical terms, and in future terms, they will go together. High unemployment and inflation, very high inflation rates. And it's a dangerous combination of a massive amount of money together with scarcity of physical products. We are now talking on physical products, not services anymore. Everybody is going to the store to buy food or to buy hygienic stuff or something like this. And most of us don't go now to make their hair or to get their services. They are not allowed. So less products are produced. People do not work, and they can't import or export because global gates are closed. So you have to pay for fewer products while you are unemployed. So I can't say good news about this. I hope we'll have good news about medicine or immunization or something like it. But in regarding economic situation, it's a very unpleasant situation where even the governments don't have any more monetary tools to deal with high inflation, because interest rates are so low. So what will be that we won't have products, and also the shutdown in most countries devastate especially small business. Big business, they will have time to survive, but small business will be closed and they won't have the ability to recover, not without government assistance, which is very difficult to provide to very small business and a lot of gig workers. In countries where small business are very significant and where a gig economy is significant, like in Israel and in Europe and other countries you come from, this means medium to long-term unemployment, because even when shelter in place is removed, the job will not be there and there will be not return with the current employers. So sorry to tell you that I am not a woman of good news regarding the economic situation. It will take time, but let us survive and be healthy, and then we'll deal with economic situation.
So thank you,
Bruria,
Nava.
before you move on, sorry, we have some questions from the crowd, which are related to what Professor Haruvi just spoke, if I may.
Thank you.
So Marcella is asking, how will governments be dealing with the increase in costs in pensions and unemployment benefits that now need to be paid to unemployed people around the world? And there's an anonymous attendee who's asking, are there any opportunities out of this crisis?
Yeah, many opportunities. I'll answer these two questions. First of all, pensions, there will be a problem with future pensions. Present pensions you will get present pensions, but future pensions I can't say you will have. So government will print money and print money and print money, and it will help in the short run, but not in the long run. So they will have to raise taxes, but people don't have with what to pay taxes. And I'm sure there will be some compulsory bonds that governments will sell or obligate their citizens to pay for. So only print money and only help in the short term. And there are many opportunities. I don't know, Bruria, if to answer now, because I think there will be a question about it.
No. We'll address it a bit later. I want to actually refer to Zohar now, because we heard some very harsh estimations and assessment of what's happening today and what is going to happen in the very near future. And I would like to ask you, how can we best actually deal with the stress of the public? Is the public stressed because of the health issue? Is it stressed because of the economic, the unemployment, or other things? And what can we do to actually alleviate this?
Well, first of all, it's both of the factors that you mentioned. Public is stressed, if not almost traumatized, because of the health situation, because of the uncertainty, due to the fact that there is, as you all heard from Nava, harsh economic situation. And there is another thing that people tend to overlook. Normally, when we are in a stress situation, we can elicit two actions, fight or flight. But this is a kind of situation where we are forced not to do. In other words, we have to sit back and do nothing, which means that the stressful situation cannot be alleviated by the natural response system that we have. So all of that create a kind of mixture, which is, to say the least, is very unhealthy for all of us. Now, the other question that you asked is how to alleviate it. It's quite an issue. Now, I know that the media, the papers, and also the social webs are full of all kinds of advices. And I think, to a certain extent, all of them are valid. But I think we have to go also beyond them and to have some kind of realization that we are in a kind of a junction. And the junction is either to go to succumb to our habits and get crazy, or to really realize that we have another option and to choose it. And the other option is to play the responsible adult. But I know that it is easy to say than done, but I think this is the very important option that we should choose.
Thank you, Zohar. And I want to take your words about be a responsible adult and how all of us should behave and how we can actually influence on the behavior. And I would like to refer to you, Gili, and ask you, in that respect, what is the role of the media? And does the media help us to become the responsible adults or the other way around?
We have to use the media as a tool in order to deliver, first of all, the information and to try to bring the public to be a part of what we are doing. But I think we have quite a lot of challenges in which we have to deal with in order to achieve it. First of all, we have to gain the trust of the public. We have to have a coordination between all the organizations that deliver the information to the public. We have to deliver it in many languages. We have to be able to answer the call centers and the calls of the public. We have to deal with the unknown situation for the public and for us, and to deliver a timely and accurate information, and to deal with people with special needs, and to deal with the rumors. So in order to do whatever you said, we have to deal with all these challenges in order to be able to share the information, and really that the public will listen to us and do whatever we want them to do.
Thank you, Gili. And you talked about trust. We want the people to trust us. Mink, I would like to ask you a question that was actually asked by one of our attendees, Jimmy, asking, can we actually trust the information that we are getting? Is it possible that we're not hearing the right numbers from different countries and this is the basis for making decisions? What is your opinion on that?
Again, this is a difficult question because systems are different in different countries. I have worked in the People's Republic of China in an AIDS program. And it was a whole floor, and I had my office there, and one floor below us was the tuberculosis office, another floor. I walked down from the office where I was after issuing a request that all HIV positive people would be tested for TB. And I went to the TB people and said, why don't we test all the positive TBs for HIV? And the answer was, information is a state secret. So whatever you hear from a place like China should be taken with a grain of salt. There are rumors of much higher numbers of fatalities, but it looks like that they have achieved control over the epicenter of the epidemic in Wuhan particularly, and in Hubei province in general. They do have more cases. A lot of them are imported into the region and not really autochthonous from the place where the epidemic occurred in the first place. And we should learn from their experience, no doubt, even if their numbers are incomplete. We should learn from their experience. There's nobody in the world so far who has really seen and gone through the clinical and the epidemiological issues of this epidemic like the people of Wuhan.
Thank you, Mick. Nava, I would like to ask you a question that was raised before even our webinar and during the webinar, asking, is it likely, and this is also in light of your very severe forecast, which you relayed before, is it likely that the COVID-19 will cause food security and actually impact on the livelihoods of the rural people or even people that residing in cities, and hunger may become a real problem?
I'm afraid to give the answer. The answer is yes. Yes. Because, you know, one of the conclusions of this crisis is that each country should be responsible to its own supply, to its own food supply. You can't trust import and exports without the world. It's what we know now, but it won't be forever, and it won't be in the short run. I'm not sure about the long run. So people won't have, maybe not have food and not have any means to buy food. I'm afraid that people there will be food scarcity, and I think that food security is one of the main issues that we have to take care of. And just now, I remember the biblical story of Joseph and his brothers. And in Egypt, they had a lot of wheat supply wheat supply that could help with the famine, and now we'll have to be sure that we have food. And also, like we don't have now, is products for medical care that we don't have. It's like now it's like food. So if there is scarcity of medical products, why won't be a scarcity of food? So, but I think that people will change even their food consumption, and there will be huge changes in our consumption of food, of services, and of everything. So throughout the world, most people will survive, but there will be even needed a lot of education how to use scarce products in the future.
It seems that we needed Joseph.
Yeah, we need Joseph and Benjamin.
Mick, you wanted to also relate to the hunger.
I think the issue of scarcity of food has to be classified by where you are in the world. Imagine a lockdown in India where people live, like they say in Hebrew, from hand to mouth. They provide themselves with enough money to go through the day, to buy food for the family for the day. Now imagine that they cannot go out of their dwelling for a week. There will be hunger right away, even if the production of wheat and corn will be changed from animal fodder to making loaves of bread or spaghetti. Still, the poor in the developing world will be the first to suffer hunger.
Thank you, Mick. Zohar, I would like to approach you with a question that has to actually deal with the connectivity between the mental health and solidarity and the economic situation. And this was actually asked by one of the attendees, by Carlos. He's saying that he has a business, and they're actually under great pressure by the tenants that cannot pay their rent. Now, on the other hand, he also is suffering for financial constraints. He wants to be understanding. He wants to look at the solidarity towards the people that are finding it financially problematic. But he also has his own pressures. Then what would you say? Is there an answer? Can we give any help to such dilemmas?
It's a very important dilemma, but I think this dilemma belongs to the realm of ethics and moral. because I'm not sure it is highly related to mental health, because in a situation like that, such moral dilemma becomes more apparent, more present, because on the one hand, we want to be compassionate, and on the other, as Nava saying, I mean, Nava became our raging prophet, but of course she's right. I mean, she's right in her approach. But when a situation of starvation or scarcity of means, it elicits some kind of demons in our species as a whole species, and we cannot predict what people might do in such situation. So
You're mute. Zohar, please unmute.
So I want to emphasize the issue of morale. We are now obliged to have a very big concern about where we want to put ourselves in terms of moral judgment.
Thank you. Gili, I would like you to also relate to that issue and taking it into the risk communication and our utilizing again the messages that the media is providing to us all. How does that come into effect, and can we help with these moral ethical dilemmas by presenting messaging through the communication means?
It really depends the message that you want to deliver to the public, because it depends the country and where you are. Of course, each country will deliver different messages, and in a country will have different messages to different people inside the country. So it's really a matter of the messages that you want to deliver. Crisis communication is something that is supporting the disaster management. It doesn't come, you don't rule the event by crisis communication. It's only a tool. So you have to have the messages that are relevant to the way you want to handle the crisis. So this is the way you do it. And of course, you will have different messages to different people in your country.
Thank you, Gili. And we're all discussing the different ethical dilemmas, and there are many more than what we have discussed. And I would like to raise another both operational issue, which is also an ethical dilemma, is who do I provide? Orit, can you please mute everyone? Thank you.
Sure.
Can you relate to who do we, in different countries, who do we decide who will get the ventilation machines, which is something which is greatly discussed. We saw some countries saying anyone over 60 years old will not be resuscitated, will not be ventilated. Other countries are still deliberating and discussing this. How can the medical as well as the social system relate to this issue, and do you think there is any type of help which we can provide in order to make such decisions?
First of all, by the color of my beard, you can tell that I am high risk. I'm in a high risk group, no doubt. Now, in Britain, in the 70s of the 20th century, I'm not talking about the Middle Ages, you were not provided with treatment by hemodialysis if you were above the age of 60, period. I worked with one of the most religious Christians on earth who ran a small hospital in rural India. And he had a rule: if a baby is born less than 1,000 grams of weight, the baby gets supportive treatment, but he's not put in an incubator because they don't have enough incubators. So this dilemma is not new. It has been with us, and we had to deal with it. There's a paper in the New England Journal of Medicine written by the commander of the Israeli field hospital in Haiti, and he emphasized the importance of choosing patients whom you can help, who are salvageable. So what I would suggest is strengthening the ethics committees of hospitals who have to help the hospital management to make tough decisions, and add representatives of the community so that at least the community feels that it is involved in these terrible but necessary decisions.
It's not hard to be in the seat where you make those decisions. Nava, I would like to there are several questions asked by the attendees concerning specifically the tourism area. And people are wondering if it will be possible to actually rehabilitate or restore tourism to what it was, or will people not have money or not have the inclination to continue to travel? Can you give some forecast or some comments on that area?
I think that it is, it's a short crisis. It won't take 10 years like the big crisis of 1922. It will take, I don't know time. It won't take as long as time, and I think that people's memory is short, and they like to have good things. And when the world will become more secure, I think people will go around and go on with this. People who can afford themselves. And now, all people will need this consumption. What I think now that government should substitute the flight companies, because they are very, very important issue in the future, in this future. So I think now that I'm in Israeli, our government should help El Al or any other flight companies to survive, because it will be needed later on, and it is a very important resource for people for people for further globalization and going through the world.
Thank you for giving some hope and something positive concerning what we're facing. I would actually like, because we've been talking about so many concerns, before we proceed, I would like to approach our attendees and ask you, and we will do so again in a poll, what is your major concern concerning the COVID-19 crisis? Orit, can you please put the question on the screen? Orit, can you please put the second question so that we can vote on what is the
Yes,
major
I just launched them. 1 second.
Okay, thank you.
Let's just try it again. Can everyone see?
Yes, thank
Great.
you. So we have access to testing, risk communication, mortality and morbidity, mental health and social resilience, or economic consequences.
Yes. So we're almost halfway there. So far, economic consequences seems to be the most popular one.
The major concern.
Yes, we're almost there.
Okay, can you
Let's
present the results?
Yes, I know. Here we go. Share.
Okay, so 48% believe that the major concern are actually the economic consequences. So I would like now to present the questions, and any of our panelists that would like to refer to that would be great. There's a question that has been raised by many of our attendees concerning the responsibility of the high income countries in relation to low or low mid-income countries. What is going to be the responsibility of the stronger economies in the world concerning any help or restoration that will be needed in less fortunate or less strong economies worldwide? Who would like to go first? Mick, please go ahead.
I think that human nature hasn't changed. And I think that solidarity between countries is not altruistic. We will need a very strong incentive for the haves to help the have-nots. And it is the responsibility of international organizations to try and stimulate us to do so, because just out of goodwill, it will not emerge.
Okay, Nava, you wanted to also relate to that? No, you need to unmute. Nava?
Okay. I'm sorry that I feel that because of me, you are so much afraid of the economic consequences. So I'm sorry. I begin by a small joke. A small joke. It's better to be healthy and rich than sick and poor. So if you can choose, so choose the right side. But it was a joke. I think that the nature of people and the nature of countries is, first of all, to take care of their own people, of their own citizens. And we can see now regarding medical products, how there is a war in the world. There is a war in the world. Everyone needs it for its own. We are used to trust on United States, and I don't think this country will be strong after this crisis. Maybe China will be stronger than United States. We don't know. So I don't think there is a country that we can trust. In Europe, there are many problems because of now many problems, and we saw that Britain, we got out of the European market. And so I think the now separation will be much more than united efforts. I don't know even what will be in Europe and what will be in the world, but there will be a problem to have one country or one president who will guide the world. And I hope that after each crisis, there will be some cooperation, which won't be very easy to do.
Thank you, Nava. Zohar, you wanted to relate, but please unmute yourself.
Yeah, I want to say that such a situation is an opportunity or the precious time for upstanding politicians. We used to not to trust politicians as a whole, but this is the time, as said before, that some brave and courageous politician will arrive, will emerge out of this mud, and perhaps can lead different ways and different approaches. So against our very nature, solidarity and altruism, and also not a very narrow interest thinking will prevail in such a time. Let's hope that that history or the present will allow such an appearance to become true.
Thank you. And Gili, I thought you also wanted to relate to that?
I think there are many reasons why countries will want to support. It's true that there will be less money, but there are other reasons in which countries want to support. Some are politics issues, some are ROI reasons, and there are other ways to support and not only donation of money. So I believe that there will be less money in the beginning, but countries will want to have influence in other places. So I think that you will see support, but you will see less money donated by the big countries that are donating the money.
Thank you, which means that it will not only be up to the countries and so on, the philanthropic world, and each one of us as individuals will probably have a chance to make an impact, small or large. I would like to raise some additional aspects that we haven't discussed as yet. And I would like to ask you, Zohar, this is a question that was raised by Fuzia. She wanted to ask you that considering this overwhelming situations with people that had precedent mental health issues even before the COVID-19, do you think that they are now becoming more vulnerable due to their situations before and their immunity system? Does that make them more vulnerable to be ill now?
I want to say that the only answer that is possible is a very general one. We know the relationship between our mental health situation and the immunity system. However, not everyone is affected in the same way on the one hand. And also, it is very interesting to see that immunity system is highly affected by severe stressful situation and on not all the spectrum of psychopathology. So I'm not sure, as we need to know what kind of psychopathology is at stake, I'm not sure that any psychopathology or previous history will affect the same way the immunity system. And even that, we have to be very cautious, because although we establish some relationship, it is very individually affected.
Right, and
I just want to add,
yes, go ahead, Gili.
I just want to add that the risk communication is an important tool in order to support the public. Usually we say what to do, how to do, and why to do things, but we also have to support the public to give them the tools how to overcome the situation. And by that, by supporting the people, we can lower these things to happen.
Thank you, Gili. And I want to continue with the issue of communication, but it's not only us that are controlling the media. We also have, we know the new media and varied channels that we're using. And we have seen throughout this crisis also rumors, fake news that also have an impact. So I would like to ask you, how do they actually impact? And is there anything that we could do, and how we can cope with that in order to make sure that there is information that is accurate, getting to the people and influencing them as we would like?
First of all, we can say that the rumor spreads faster even than this virus, and this is something that we saw. And when you don't have the information delivered on the right time to the public, and if they don't have trust, they will look for other places for the information. So we saw during this, I think, during this crisis, we saw several misinformation that was delivered to the public. Most of them was kinds of theories, conspiracy theories. Some were dealing with ways how to cure the public, for example, to drink bleach. Some were related to a vaccine and to personal protective masks, which can be used. But on the other hand, I think we saw quite a lot of good solutions that were used during this crisis around the world. So as I said before, first of all, we have to build the trust of the public. The second thing was really to give the tools to the public, to educate the public to understand what could be a rumor. And if you think that it's a rumor, please look for information in the right resources. Go to the WHO, go to the Ministry of Health, etc. And another thing was to really monitor the new media and to see if there are all kinds of rumors. A lot have been done with working with the big players like Facebook, Twitter, etc. And they are really trying to kill rumors when they are small, and really to tell the public to look for information in the big places like the Ministry of Health. And of course, working with the media by delivering them the information on the right time so the public will receive it. So in order to fight the new media, we have to, the rumors, we have to be rapid, relevant, and accurate in order really to fight the rumors. But we have all the time rumors, and we have to fight it all the time.
Thank you, Gili. And Gili, related to the, I'm coming to you, Mick, but I would like to pose a question, and then you can also refer to what you wanted to. Gili spoke about the need to be rapid, to manage, to actually coordinate the response. And I would like to ask you, who actually should manage the COVID-19 crisis? Is it medical personnel, or is it something which is much wider? Is it politicians? Is it economic personnel? We heard from Nava. What is your opinion? Who should actually manage this situation?
First of all, I think we should switch the term rumors to the term fake news. Rumors are spread because of malice. Fake news are spread with a very clear agenda, and there's plenty of those around. Including elections, including smearing of people. There's a lot of really fake news. The only way to fight these is by giving facts, by telling the people what is going on, what is true and what is false. Now, the conspiracy theories have really a very wide base because of uncertainty. And uncertainty is the mother of anxiety, and anxiety is the mother of mass hysteria. And this is something we need to fight, for example, by telling the world that all the epidemics so far have died out a natural death, with our help or without our help. In this case, we can hope for a vaccine, and we can hope for widespread immunity before we have vaccine, what we call herd immunity, which will make transmission less likely. The virus will have no susceptible people, not enough susceptible people to attack. And then the exponential curve turns over and becomes exponential by going down.
I want to relate, Bruria, to your question, who should lead such a situation, right?
Mm-hmm.
And I think this is some of the things that we emphasize in our program for management disaster. Because emergency and disaster situations are by definition an example of complexity. And complex situations demand a team, a multidisciplinary team. And I know that people, normally, not all governments and not all people who deal with it actually have in mind the potential of getting the right managing when you have a really interdisciplinary team coming from all over realms, coming from even from realms that we mentioned today, even philosophers of ethics, as well as mathematicians and some other that are not seemingly related to the situation. The answer, the solution lies within this kind of large brain of people coming from various disciplines, knowing how to work together. And I think, in a way, this is one of the things that we emphasize in our program, that all our teamwork is a kind of example for this specific goal.
Thank you. And this is a very important message that goes to almost everything that we do in disaster management is working together and collaborating. I would like to raise another question that was raised by Alice, one of our attendees from Italy, which is a country which is very highly impacted by the COVID-19. And she's asking, and this is also mixed that these are hard questions, well, this is another hard question. Is the lack of preparedness, of strategic planning the main problem? She's speaking about Italy, but I think this is a much larger and wider questions. Or is it actually a lack of strong leadership and clear communication to the citizens? So I'm inviting any of the panelists who would like to actually relate to that. Is it preparedness? Is it leadership and communication? Who would like to go first? Go ahead, Zohar.
Well, it's an important question, and I think it's another example of what I just said before. It's not either or. The most important aspect here is about preparedness, because we know that although there were information about that such a pandemic could emerge, not enough preparedness was made prior to this situation. And one of the things of anyone who wants to deal with disaster, we know that the major aspect of it is preparedness, but there is a problem with it, because when everything is fine, there are only very small number of people who can, when the sunshine is fine, can think of days where it will be storms. So one thing is preparedness, but of course the other is about leadership and communication. Actually, her question is just another example that it's about not either or. It's a multi-level aspect and demands multi-level thinking, which normally people tend to overlook.
Gili, you wanted to say something?
I think it's something that we are dealing with a lot in our program, and this is, first of all, the preparedness is very important, but sometimes it's not enough. So we have to deal with the consequences when something happens. And of course, when you have it, you have to take the decisions. And sometimes when you want to take the right decision and you wait to have all the information, sometimes it's too late. So sometimes we have to take the decisions when we don't know everything. And this is the situation with this event, which you have to take decisions even before you know what really will happen. And I think that it's a combination of all the three things that you raised before.
Thank you very much. Yes, Moran, go ahead.
I think, well, since this is one of the fields I study most, it's I think a common thing for human beings to procrastinate and to delay anything that has to do with emergency preparedness. We just don't want to deal on a daily basis with emergency management. The people sitting in this webinar, as well as the people attending this webinar, are very much interested in emergency management, and they are keen on understanding how we can promote preparedness and coordination between organizations, countries, etc. But for most people, it's really an issue that they prefer either to not discuss on a regular basis or just postpone to when the threat becomes real and imminent, which is often too late. And the thing is that we as disaster managers, we have very limited attention span from decision makers and politicians, and having their attention during routine time when there is no backing from public to deal with emergency management, that makes it that much more difficult to convince those decision makers and politicians to invest time, money, effort, and people into creating those plans and coordination. It's so difficult to do so. And then when we are faced with such an emergency or disaster, that is when people start to ask, well, why weren't you prepared for this? Why didn't you take the time to consider, plan, write protocols, et cetera, et cetera? It's always on an ad hoc basis, always when it's a little bit too late.
Thank you. And this is why we believe that it's so important to study the field of disaster management to raise more and more awareness. Nava, you wanted to relate to that too? You need to unmute. Nava, you need to unmute.
Okay, I want to relate it from an economic point of view, and this is a crucial problem. When you estimate the benefit cost value of prevention, it's huge. It comes between at least 4 to 8 to 10 times each dollar that you invest in prevention brings about $10, in less damage. So it's very, very important and it's very economic. But the problem, as other people said, is that you can't show what you prevent. You can't say, oh, I prevented the corona, I prevented 50 deaths or 100 deaths or so on. So there is a lot of apathy about this problem, and I think it's the big issue of this program, to show that from all points of view that you take, you have to think before, then to cry afterwards. And for this, you have to make economic analysis and medical programs and communication, all the rest, and risk assessment, all the rest that we discuss to show this importance and to make this computation in order to bring it to decision maker mind and to the public. So I hope that after this crisis improves, or I don't know, we'll change our ways of thinking about the future crisis. Thank you.
Thank you, Nava. And I have to say that there are many more questions that have been submitted, many more, unfortunately, than what we can answer in the time frame that we had, because we have almost reached our time limit for this webinar. But I want, before we say the concluding words, I want to ask you, Nava, because you gave us the forecast, which is certainly realistic but very severe. I want us to actually relate to opportunities. We say that each crisis is not only a crisis, it's only also enabling us to take it, to seize it as an opportunity. And I want to ask you if you see any opportunity in this, and I'll just one more complimentary comment, which came from one of our attendees, which asked, for example, could it be that because of all of the fears of our immune systems and what happened with the COVID-19, will the natural herbal food now be enhanced business?
Of course. Sorry, I'm coming to...
You're okay? We hear you well.
Okay, because I don't see you, but it's okay. It's okay. Okay. I think it's each crisis has its own advantages and disadvantages, and I think that there are many, many opportunities for the public, for the government, first of all for the environment. I think that the big gainer of this crisis is the environment, that now faces less and less air pollution, and there is hope that there will be less global warming and less pollution because people will change the way that they think and see. I also think that I'm on the head of economist, but I think that on personal view, each of us will look at different at his family, at his friends, and at his life. But now I go to economic. Of course, there is now immune system is very important, and like preventing disasters, we can prevent health issues. Instead of just looking at medicines, we have to put much more on prevention. Prevention is everywhere, in health, in disaster, in family communication, in social communication. So let's take better care of us. So there is many opportunities for herbals, for alternative health, and also, as we see now, we are talking from remote, a lot of opportunities for technology and services for remote business conclusion. A lot of opportunities for marketing networks of food, hygienic stuff, and other one. We see that we can stay at home and bring our words. Now we are united. There are about 1,000 people here from all the world, and we talk to them. I'm only sorry that they can see me and I can't see them. But you see, it's a huge, and this the Corona brought us. The Corona brought us to talk, to see each other from abroad, for remote distance. And also, I hope that regular medicine will now, as Israel, you know, put a lot on security. But now, till now, security is only airplanes and tanks and so on. War. But now we understand the security is also a good medicine and good food supply and so on. So there are a lot of opportunities for private people, for the public, for governments, and for the world. So I began with pessimism, and now I am optimistic.
Well, thank you very much, Nava. And I think what we have learned, Mick, just 1 second. I will give you the mic in a minute. I think what we have all heard that there's such a wealth of knowledge, and disaster management is a profession. We need to strengthen the profession. And just before I will let Mick speak, I would like to pose a question to all our attendees. How many of you that are with us right now are actually interested in furthering your study or your work in the realm of disaster management? We invite you to very quickly respond to this. Yes, no, or not sure. Orit, can you share the opinions of our attendees with us?
Yes, we have about 60% voted. Let's just wait for one more minute. Okay, so our results are 56% are interested, and the rest are no or maybe.
Okay, thank you very, very much. Mick, you wanted to respond. You wanted to say something?
I want to give the example of Nepal. Nepal was in turmoil and had political difficulties no end. And then a major earthquake hit, which brought people back to their senses. And there was a political change, which carried with it a new attitude of dispersing responsibilities from the central government to local governments. And one of the results, and this is a litmus paper, this really tells you the truth. All of a sudden, all the power failures, which were a daily chore for Nepal, completely disappeared because of new management of the electric company. Unbelievable. So there is always hope that a disaster will shake things up, literally in Nepal, and bring on a change of attitude and a change of priorities.
Wonderful, and it's wonderful to end in this a more positive and hopeful overview of what's in store for us. I would like to thank all of you for participating. You could see that there are many more questions that we had time to answer, and it just means that we need to have more collaborations, more sharing of information, more and more professionals coming to study the disaster preparedness and disaster management in order to have a body of people who can lead this important aspect of life, which makes all of us, all our societies, more resilient. The panel discussion and the active participation of all of you attendees, is part of the global struggle that we're all a part of to contain the coronavirus and hopefully get the normalcy once again. It's not surprising, it's actually expected that there are many more issues that concern or intrigued us, and we're all required to continue in our joint strive to collectively work together in order to fight the coronavirus and empower our individual, our community, our national as well as international resilience that is important to all of us. I believe that we should not focus on any borders between nations. You know, the coronavirus, the COVID-19 doesn't respect borders, then why should we? What we should do is establish a very defined border between humanity and the virus populations. And we can only do that if we can work together. I invite any of you that are interested in becoming leaders in disaster management to join us, to join many other professionals, and specifically those of you who are interested in furthering your academic education. Join us in our master's program. I believe that working together is something that will be able to make all our global community safer and more resilient. I would like to thank our panelists, Professor Alkan, Professor Nava Haruvi, Mr. Gili Shenhar, Dr. Zohar Rubinshtein, Dr. Moran Bodas, and Reed from the TU International. Those of you that are interested in contact us and ask us additional questions, or Reed, can you put the slide on so that they can know how to contact us? And we will be more than happy to share with you any insights and any information that is interesting to you so that we can continue the collaboration, not stop it here, but throughout this crisis and throughout the next weeks, months, and years ahead. I would like to wish all of us safety, health, resilience, and good joint work in order to make our world a much better place to live in. Thank you, everyone, and have a safe day. Bye-bye.